So for those of you who are live and those of you who will be watching in a little bit, I want to thank you for being here. My name is Bryan Kanney. I'm Assistant Director for Career Development at the Heller School. Again, I work primarily with students from our global programs, and Jasmine Waddell, who others of you know, work with students from our domestic programs. And today we have HIMSS with us as part of our virtual DC trek, as we can't be in person. And I know you don't want to hear from me, so I'll turn it over to Evan and Tom if they want to self-introduce and sort of go from there.
Sure.
Yeah, Tom, kick us off.
Oh, wonderful. Hi, everybody. I'm Tom Leary. I'm Senior Vice President and Head of Government Relations for HIMSS, and I'm also the Executive Director of the HIMSS Foundation. I'm excited to be here and chatting with all of you about the power of HIMSS and the global reach that we have. So I'm here with my two colleagues, Evan and Amanda. So Evan and then Amanda, please.
Yeah, I'm Evan Dunne. I have been with HIMSS for 5 years on the government relations team. A little bit about me. I graduated from George Mason University, which is a school in Northern Virginia, about 40 minutes to DC. And that was my first entry point to working in policy. I had a background in political science and was working on Capitol Hill, working for legislators and for elections, but really found my passion in health and health IT policy specifically. And I found HIMSS 5 years ago and haven't looked back from the political scene. So it's still what brings me out here. I'm located still outside of DC in Northern Virginia. And yeah, I think it's an interesting pivot from working in politics to now working more specifically on health IT issues. And we'll talk a little bit later about the advocacy work we do and some of that work we have with our relationships with federal and state officials. So I'll stop there and let Amanda introduce herself.
Hi, my name is Amanda Krzepicki. I've been with HIMSS about 2 years. My boss, who is on paternity leave, actually went to Brandeis. But I went to Virginia Tech, so go Hokies for undergrad. And then for graduate school, I got my master's of public health from the George Washington University here in DC, where I currently live. I do a lot of our relationship management with federal contacts. So I primarily work with members of Congress and their staff to help make sure that HIMSS's priorities are known and that we're advocating for good policies for our country.
Awesome. And I'm going to go ahead and share just a few slides. Wanted to keep it conversational, but I understand too, a lot of students are going to be listening to the recording. So for visual, I'll share some slides.
So Evan, while you're doing that, I just I came to Washington 1992 on an internship and worked for Congress and then the federal government in the Pentagon before working in industry for a defense contractor for 2 years, and been with HIMSS for it'll be 20 years in August. So seen a little bit of everything, and sorry, I thought we were going to hit that later, but there we get the baseline out of the way. Thanks, Evan.
Yeah. Glad we're able to do that. I like to talk a little bit about where we came from too, as much as it is important to learn about HIMSS, but kind of career paths too. And as students, you know, we think we're going to do one thing and then you kind of pivot and do another. So for me, I thought I was going to be working, you know, for legislators and congressmen, but I really found out what I didn't want to do through internships and experience. So I think it's just as valuable to kind of hear someone's career path and lessons learned from that as it is their organization as a whole. So feel free to connect with us after the presentation if you have questions. And again, Tom is a wealth of knowledge about HIMSS, 20 plus years. And like, of course, Amanda and myself are going to make ourselves available if you have any questions. So
Yeah.
Just diving quickly about HIMSS and what we are, if you haven't heard of us. So this is what we like to call ourselves. If you were to have a dictionary of what HIMSS is in the dictionary, this is kind of what the definition is at a high level. So HIMSS is a global advisor and thought leader supporting the transformation of the health ecosystem through information and technology. So this is what HIMSS is as a whole. There's a lot of different pieces of HIMSS that we're not going to cover today, but really that in and of itself is our core of what we do here at HIMSS, transforming the health ecosystem through information and technology. And then this is our vision and mission. A lot of times folks wonder what we do to kind of why we get up in the morning to do what we do. So this is kind of encapsulates what we do. So our vision is to realize the full health potential of every human everywhere. And our mission is to reform the global health ecosystem through the power of information and technology. So everything we do is encapsulated between our vision and mission statements. And these are very integral into what we try to accomplish here at HIMSS. A little bit numbers for you. So we are a membership-based organization. So we have 120,000 individual members, and that number grows by the day, week, month. So it's not an exact number, but this gives you a rough estimate of how many people are HIMSS members. And then this kind of divides it up nicely. We have 500 nonprofit partners, 550 corporate members, and 420 provider organizations. One of the neat things at HIMSS, I always tell people that are trying to know more about HIMSS, is just the breadth and depth of our membership. If you have a specific question about a niche topic in health IT, there will be a member that any of us on the GR team can probably connect you with, which is an incredible amount of folks that we have at our disposal for being HIMSS members. So just by the numbers, I wanted to give a quick snapshot of what we look like from our membership and kind of how we try to carry those members. We want to carry those policies that represent those members and encapsulates what they are trying to move forward in health IT. So this is a little bit about who we work with as well, specifically. So here on the government relations team, we have influencers from government. We work very closely with government agencies such as the Office of the National Coordinator, ONC, CMS, the Centers for Medicaid and Medicare Services, the VA, you name it, we probably have some sort of touch point with government agencies on a federal level. State officials as well. We work closely with public health departments. We work with chief information officers, chief medical officers, really any sector within the government of a state, federal, and local as well. On that level as well, we have relationships with that we work with. Again, I mentioned the 120,000 members and our stakeholders as well. Really runs the gamut of anything within healthcare. And you really see that come to fruition at different events we hold, such as our big global conference, which we'll mention. And then our other events, we do advocacy events within our chapters on a local level. We're really trying to champion some of our communities to gather like-minded folks that have similar goals within health equity or what have you. So really kind of on a broad level, that's these are the folks that we're working with on a day-to-day basis to move policy forward and transform healthcare. And I mentioned our North America engagement. So this map kind of demonstrates where we have chapters. Each dot represents kind of where those chapters are located. So for you all, if you're on site in Brandi, we have a New England chapter, which encapsulates Massachusetts, Rhode Island, Connecticut, Rhode Island, New Hampshire, and Vermont. So that is our New England chapter there. And usually they'll gather in different locations around the New England area, but specifically Connecticut and Massachusetts are two of the bigger areas where folks will convene for events in that sense. And again, we have 57 North American chapters. We have other communities that are global, but these are kind of our, where I was at least before we kind of are going to talk about our global expansion in a minute, but this is where a lot of our focus was from a chapter engagement perspective. And part of my role at HIMSS is helping out these chapters and carrying out policies that they're trying to move forward at their local level and going forward through policy initiatives that they might have. So 57 chapters and growing. You see Puerto Rico there. That's a chapter we have that is relatively new, but also making a name for itself. And then our Canadian engagement too is really important. So up there we have our Canadian folks that are having chapters as well. So we're trying to understand policies that they're trying to work on, which is a little bit different from the US, and also take lessons learned that they want to learn from the US and how can they apply those in Canada as well. A quick look at a global map here. So this is our HIMSS global footprint. We have HIMSS Europe, we have a HIMSS Middle East, and a HIMSS Asia Pacific. And those markers there are kind of where those hotspots are. Tom, do you want to talk a little bit about some of this global work that we're
Absolutely.
trying to do?
Yeah, thanks, Evan. We have members in just about every corner of the world. You know, what you see on those markers is offices that we have in various countries. You know, the 4 offices in England and in Spain, and 2 in Germany, as well as in Singapore, in Australia, and then Chicago and Denver, Colorado, and then of course our Arlington office in Virginia, just outside of DC. The teams are designed to engage with members who from across the globe, and we're always trying to grow the number of members. The country of Africa is grayed out because we don't have a specific office there, but we do have an engagement in both in Egypt and in I believe Malawi is coming on board. You know, and just we're very excited about engaging in every part of the world, because what we found from a policy perspective and just from a practical health IT perspective, many of the issues and solutions are borderless. So I know we'll be talking more about that in a little bit, but it's global reach of the organization. Thanks, Evan.
Yeah, so kind of shows you too, if you're interested in a specific part of the world, what they're doing. A lot of times we have contacts and HIMSS members that are in those countries on the ground there that could, you know, help us with informing us about their policy. So a lot of activity going on globally there. Just to give you a sense of our HIMSS government relations team, what we do on a day-to-day basis as well, these kind of 5 buckets encapsulate really nicely of what we do. I mentioned our advocacy work. So this is through our chapters. And we also advocate on a federal level too, but we really rely on our chapters as those grassroots advocates to help inform us what those priorities are, what their what other folks in their state are saying, and then helping them kind of deliver on those advocacy priorities and, you know, scheduling visits, scheduling campaigns. You know, we sometimes support them at their state health IT days, which are specific days dedicated to health IT policy. So that's what some of the advocacy work we do. Analyzing policies at a federal, state, and local level. So this runs the gamut of, we, you know, will write letters to federal governments when they put out proposed rules, or they want to get some feedback for proposed rules. So HIMSS will respond to those with some of our partners we have, and utilizing our stakeholders and membership to gather feedback and then submit those comments to the federal governments, and also state and local governments as well. Sometimes states will come to us looking for ideas or feedback on their state health IT plans or roadmaps or different initiatives within their state that they want feedback on. And we utilize our expertise, but also our members' expertise, and carry that voice forward as the HIMSS voice to inform them about policies and recommendations we have based on those proposals. Organizing and training. Part of my role too, like I mentioned, is working with chapters. So we help kind of champion newer chapter advocates to understand what it's like to advocate on behalf of HIMSS and on behalf of their chapter. Thought leadership, again, we put out written resources. We do presentations like this to kind of inform you what HIMSS is, and also we deep dive on specific topics as well. We have different communities that are dedicated towards specific topics. We have social determinants of health group. We have health information exchange groups. We have equity groups, like I mentioned. It really runs the gamut of all things health IT policy. So that's where that thought leadership comes from, in the form of oral and written resources. And then convening too. Our convening power is at full front for our global conference. You see, we typically gather around 30 or 40,000 people in the same, under the same roof, all focused on health IT and anything and everything between that health IT umbrella. And also just convening folks from a state level as well that we mentioned, and also globally too. A lot of times you saw that global map. We're trying to gather the globe and make it a smaller place. and having folks from, let's say, Singapore talk to people in the US about lessons learned. What are some interoperability challenges we're facing? How did you guys endure with the public health emergency with telehealth? So different things like that. We try to make sure that we can convene HIMSS members together so that they can talk to one another that otherwise they wouldn't have the opportunity to. And here's our HIMSS policy priorities. Tom, do you want to take this one or do you want me to continue?
Sure, I'll take,
Yeah.
absolutely.
Cool.
We, each year we identify areas that we're going to focus on from a policy perspective, and we attempt to focus on those items that are borderless, that so that we can have that, we can leverage our global public policy principles to have the impact not only at a theoretical way, but in these four categories that we've identified in 2022. That the work's not done, so we're keeping focusing in this area for 2023 as well. Interoperability, just pretty much it's a bread and butter of our community, being able to make sure that data is available to the provider and the patient and the caregiver where the care is being delivered, and it's as near real time or just in time data that helps to make sure that quality care can be provided. We're on a 20+ year journey in the interoperability space. It's because as we know, healthcare is always evolving, and therefore the capabilities need to be continually growing, and the information, the types of information, the amount of information that needs to be shared from point to point is continually growing and evolving as well. Connected health is, we've, as you see, access to secure telehealth, remote patient monitoring, and broadband access are three key areas. Broadband is an underlying, it's a foundational effort here in the US and across the globe. The more that people can have access to the internet, the stronger their economies are, the stronger their access to e-commerce, and of course, their greater expectations around their healthcare delivery. So with respect to telehealth and remote patient monitoring, leveraging that broadband access, you can improve access to care, whether it's the mountains of Colorado or the desert expanses in the Middle East, making sure that you provide more creative ways for people to gain access through telehealth. We saw that during the pandemic, the height of the pandemic, there was a between 40 and 60% increase, depending on the community, in use of telehealth to continue to make sure that people had access to care while keeping them safe and decreasing the likelihood of being exposed to the coronavirus. Moving on to cybersecurity and data privacy, the third key component of our public policy focus for this year is cybersecurity. Healthcare remains both here in the US and across the globe, remains a high concern for healthcare facilities and governments, because healthcare is one of the most targeted areas. Healthcare data, person's personal information, what kind of chronic illnesses they might have, or and other issues remain high value data for the bad actors in the world. So making sure that we have that level of cybersecurity. In fact, HIMSS is signed on with the International Red Cross and many other organizations, calling on the UN to declare cybersecurity an equally is important as the kind of protections that healthcare receives, the bricks and mortar facilities that receive, whether it's that cyber attacks should be seen as much of a violation of international norms as when a hospital or a clinic is bombed during a war or a conflict. The amount of outrage, you think about the outrage when you hear of a hospital or a clinic that's been bombed or been damaged by some sort of bomb or shelling during a war. We're calling on similar level of protection for hospitals and clinics to be protected from cyber attacks by nation states or individual bad actors. It's we're starting to see just an interesting point for folks is that we're starting to see that in Germany and the United States in particular, individuals' deaths are being linked to the fact that the facility suffered a cyber attack. So it's an increasingly important issue for all of us. It's with respect to data privacy, healthcare data privacy, just like any other data, there's an evolution in what's happening across the globe. The GDPR for the European countries that are part of the EU has been helping to define data protection for the individual, and the policies of the EU is impacting the way that data is protected, and privacy is the expectations for privacy is happening. If you're a company or an organization that like HIMSS that's interacting with a citizen who lives in a country that's part of the EU, we're expected to meet the GDPR expectations. So more and more multinational organizations, multinational companies are calling for a standardization so across all platforms. So that's really what we're looking at there. And value-based care is countries, regardless of the way that they deliver care, they don't have blank checkbooks anymore. There's the pandemic has had a real impact on the global economy and the economies of the world. So countries from the US and Canada were early adopters of looking at how to improve value of the care delivered and how you use health IT to deliver on that, to now countries across the globe, both in the European space as well as in Asia Pacific, are asking for what are the technologies, tools that can help us find more value over just providing the volume of care. So 4 interesting areas. I could go on all day about those, but Evan, I'm sure we want to keep the conversation moving forward.
Yeah, great. Thanks, Tom. Yeah, so these 4 really encapsulate what we prioritize on a yearly basis, and everything we do falls under these 4 categories. So when we talk about our state and local work we do, when we have chapters advocate, whether it be at their capital or sending emails or blast emails to legislators and their staff, we want to make sure that they are under these policy priorities. So again, some of the work I do is focused on state and local government affairs, and this kind of slide just details some of the work that we do. I will mention the need, the 4th bullet there, the needs for public health modernization. There was a lot of money for public health departments during the public health emergency. And so a lot of our advocacy work now is making sure that money is still flowing to these public health departments to have that bi-directional exchange of data, so they aren't left behind when money is continued flowing to states, but public health has been notoriously left behind. So we want to make sure that we're detailing specifically the public health modernization needs in the US, and that funding is as permanent as we can make it. So I'll kind of stop there, and if there's questions on our state, more on our state engagement, happy to answer those. And again, I mentioned our chapter advocacy task force. Each chapter has a chapter advocacy or a chapter advocate, I should say. And so these advocates are integral to us because they're that voice on the ground in a specific state or region to talk about the needs for that specific area, and then how we can help them kind of set up different initiatives, advocate on behalf of us in the chapter on different ways that we can help move healthcare forward and integrate more technology into policy. And these are the different ways we engage with them. Different legislative action center day or legislative advocacy days, I should say. We have a legislative action center, which we give them different tools and resources for letter writing campaigns, how to request a proclamation to a governor. And then we host these educational and networking events in their community to get to know one another, meet like-minded people. And, those are great events to kind of meet people that are like-minded, that have the same goals as you in your state. Amanda now will talk a little bit about our health equity initiatives and our drive now towards health equity as our yearly priority. So Amanda.
Yeah, absolutely. So within our public policy committee, we have a special group of people dedicated just focusing on health equity and how it can incorporate that into all of our policy priorities and move those efforts forward. So it's about 15 members, depending on the year, and they work in their communities from the ground level up to the policy levels. So this year for Global Health Equity Week, we planned a webinar that included the Deputy Director of CMS Office of Minority Health. We also had FQHCs, patient voices, and then an international voice with the Israeli health system. This webinar was recorded and is available online. We're currently working on pulling some sound bites for it to share throughout the year. And then we're focusing on bringing the patient perspective to our annual global conference, HIMSS 23, because we feel like as an organization, patients are often looked over as policy experts, kind of guide the direction at other events. So we're trying to bring that voice to the forefront of the work that we're doing.
You want to run through these, Amanda?
Yeah, absolutely. So like I mentioned, HIMSS 2023, we're putting health equity at the forefront for all of our policy development. This past year, or in 2022, we have been constantly advocating for ONC to get an increased budget. They've had the same rate for the past 10 years, but they are ONC is the Office of the National Coordinator. They do a lot of the health IT work within the federal government, for those who might not know, but they've had a flat budget for the past 10 years and they need better funding so they can continue doing the work that they're doing and expand upon the work that they're doing and increase their workforce. We're also huge advocates for public health data modernization. So that includes a lot of workforce development, which is something the pandemic has highlighted. We need more doctors, more nurses who know how to do a broad array of things, especially within the health IT space. So getting additional public health funding is necessary to kind of modernize CDC and the work that they're doing as well. And then, as always, maternal health. The Momnibus was the bill we focused on last year. That hasn't yet been reintroduced this year. We expect it to either take on the same Momnibus, which was a package of 12 different bills, one of which was passed, and then they will probably all be introduced individually this year to kind of help their odds with being included with other bills or in different packages, depending on how the year plays out. And then for upcoming public policy agendas within the 118th Congress, so far we're seeing huge trends of investigating the Biden administration and all the COVID spending that happened over the past few years. This was definitely the intent of House Republicans after they won the majority, after all the investigations House Democrats did last year into the Trump administration. And then they've also proposed spending cuts to Medicare, Social Security, and then the Senate is Democrat-led, so they're likely to mirror the Biden administration work. A current thing that they're kind of debating right now is the debt ceiling, which I'm sure many people have seen in different headlines. So that's kind of the first hurdle we're encountering this year, and seeing how they negotiate and are able to cross the aisles to work together should set kind of the precedent for the rest of the year. Within the Biden administration, we're looking to see what they're doing on telehealth. It seems like they're still kind of considering what the options are after they just announced that the public health emergency will be ending in May, which has protected the telehealth waivers thus far. Last year, the Senate did pass an extension for 2 years, so they're still kind of kicking the ball down to the goalpost on that. And then obviously they want to protect Medicare and Social Security. They're not supportive of what House Republicans are doing. They want to expand access to opioid treatments. I often think that the COVID pandemic has overshadowed the opioid pandemic. That is what the House and the Senate were aggressively working on before COVID came out. And that was supposed to be a huge focus that year that kind of fell to the wayside due to COVID. So we're refocusing on that as millions of lives are still impacted every year. And then protecting veterans' healthcare has also been huge. The VA has several different issues that they've been trying to work through. We often keep in contact with the Veterans Administration federally, and then also the House VA committees, particularly the one on technology modernization. So that's definitely in our thoughts and important to the work that we're doing. Addressing mental health kind of ties into opioid treatments, and then funding the cancer moon shoot.
And then I'll just quickly touch on some of the, again, I wanted to highlight the state work we do with public health modernization. Don't want to get too into the weeds here, but just to kind of level set with some of you, the CDC provided $3.94 billion to states for the workforce, foundational capabilities, data modernization, and technical assistance and training to states. So a lot of what our advocacy work has done are pointing out specific things that we'd like to be allocated for these funds as well. So a lot of times get all this money, but what do you do with it? So we're trying to spell that out really nicely so we can kind of detail what is needed for these states to continue to help modernize within their public health sectors as well. And then so again, workforce is definitely needed. We want to have more workforce within the health IT arena, but also keep that workforce as well long-term. So incentivize them to stay and not just kind of have this job and then leave because they're burnout, but what are these incentives that we're providing for these healthcare workers that have been so instrumental during the pandemic, and we want to make sure that they stay in the workforce for the long haul. And then this kind of gives you an idea of those specific needs I was mentioning in our public health modernization recommendations. So the report is available online. One of our colleagues who's not on the call today was really a champion in developing this, and she's done incredible work in spelling out what is needed for public health modernization. And this kind of gives you a snapshot or a Cliff Notes version of what's in that report, but definitely take a look at that and kind of get an idea of what we're advocating for on a higher level. Again, it's kind of spelled out for you here, but I want to allow us some time for dialogue and questions. And but this kind of encapsulates what we're hoping to see on a public health level there. And I'll end here with our HIMSS 23 conference. Really want to emphasize how awesome that our global conference is every year. And this year it's going to be in Chicago. There's going to be tons of different events. We have it runs the gamut of things that you're going to see there. Education sessions, networking events, bring business cards, bring questions, talk to people. Everyone has name tags. You can see what their name is and where they work. So try to network as much as you can, go to the show floor, talk to vendors, see what they're working on, and just be curious, have questions, and make sure you rely on us to see what are some sessions I need to go to if they're, focused on public policy or, anything that you're really interested in. Go to our website or reach out to us, and we're happy to help you navigate this conference, because there's a lot going on that week, and we want to make sure if you are attending, you have that ability to kind of see what you want to do, and you have a little bit of a schedule so you can kind of guide your way through. Because once you're in the entire venue, it's going to be a little overwhelming with all the people walking around. So we want to make it as simple as possible. I'll turn it to Tom to see if he wants to add anything in closing, and then we'll turn it to Bryan and students for any questions.
Well, Evan, it's and Amanda, this is a great snapshot of what we try to do every day in order to live up to the vision and mission of the organization. I will say, as a cause-based not-for-profit, we're we are focused on that vision, and bringing technology to bear on improvements in healthcare. And as you saw from our map, we're trying to do that across the globe. So with your involvement, the students' involvement, we can really make a great difference. And as people more and more spread their wings to other parts of the globe, they'll know about HIMSS. They'll know that as they're tackling policy issues and technology issues around healthcare, that they can come work with us, and we can make a real difference. So thanks for the opportunity for us to talk to all the Brandeis students, and we're looking forward to some dialogue here.
Yeah, so Tom, Amanda, Evan, thank you for being here today and taking your time to talk about HIMSS with our students, for those who are here live and those who will be watching. I do want to ask the students first if they have questions. You're welcome to unmute yourself. You can put yourself on video if you're comfortable with that, and ask your question. If you're not, feel free to type your question in the chat and I'll read it aloud. So for those of you who have questions, go ahead with that. But I'll start with a question while students get their energy brain going here. But I'm wondering, just with a constant transition, not constant, but consistent change in the legislature, right? Congress, I feel like it's you're spending a lot of time building relationships and communicating out information and just like starting over. Is that a safe assumption, or can you talk about that?
Sure, let me start and then the team jump in, but it's absolutely an issue of Health IT 101 for new staffers and new members of Congress, and state legislatures. But more and more is I've been at this for quite a while, but so more and more people are as they come into the issue, because they're tech natives, they've seen more of technology in the doctors' offices and hospitals and clinics. They're at least aware of the what it's doing and the why we have technology in place. But there is a certain level of 101, Health IT 101 for what do you mean that interoperability is still not solved, or how is my privacy of my healthcare data different than what might happen online with if I'm purchasing something off of Amazon or another website, or et cetera. So it's those types of issues that we need to continually educate, but it does help us. It helps ground us as a team and as an organization around advocacy, because we're to make sure that our messaging is clear and that we relate back to everyone. If you think about when you're interacting with state officials or congressional offices, the more you can relate to your personal experience or an experience that you might know that's happening in their area, their state or their district, the more it makes sense to them that they're helping, their policy changes are helping the community and the people back home, if you will. So I think those are good grounding principles for us as we interact with and advocate on behalf of Health IT. Amanda and Evan?
Yeah, I'll say from my perspective, adding on to that, it's always nice to hear stories. And I think we always have a story when it comes to Health IT, or what are some things that you've seen that there wasn't enough capability to have in place that would be nice. So those personal anecdotes and stories, I think, really resonate. And sometimes that carries on further with some of these folks than it would specifically saying, these are our policies, these are the numbers, these are the, frameworks we're trying to accomplish. Saying those things that resonate with folks, I think, are really important. And Amanda is very familiar with talking with offices, and especially on the Hill. So I'm sure she can elaborate or talk further on that too.
Yeah, I think, the best way to get your messaging across and our values is to just sit down with people one-on-one and have those honest, frank conversations, meeting where they're at a conversational level. It's always helpful. You never want to present to them really, because I mean, they're very qualified individuals, which is how they got in the positions that they're in. So, you know, providing information to the level they're at and then helping build their foundations is really important. And then just maintaining relationships, always being helpful. Because in the end, I mean, they're trying to tackle so many different issues at once. While we have the opportunity to be specialists and subject matter experts. So getting them connected to the right people too, that can help navigate policies and the different implications to the real world is essential.
Great, thank you. Well, all of you, Tom, Amanda, and Evan, for your input on that. Do either of the, oh, go ahead.
No, I said, of course, yeah.
Okay, good. Daniela or Shania, do you have a question for HIMSS? Not to put you on the spot.
No, it's okay. Well, I'll show my face, but I want to thank you so much for being here and for the hard work that you're doing in supporting health advocacy. I am new to healthcare information systems and from the perspective that you're talking about, I know that you're doing a lot of work in that. And so I was just wondering what hard or soft skills you really look for in candidates looking to apply to HIMSS. Yeah, that's my question right now. Thank you.
Great question. First thing we look for is curiosity. You be curious about the world around you. Be curious about what you don't know about healthcare, what you don't know about health IT. You can be taught, and I think from there, the hard skills are, depending on the part of the organization. I'll say from a GR perspective or from informatics perspective is a willingness to know and then or be curious about how the government works or how technology can improve care delivery and how policy change might need to be impacted. So, for example, if we're getting ready to go, to hire somebody new, what the kind of skills that you might have, with respect to technology background or a public health background like Amanda or a public policy background like Evan. I think they can both. I hope that they both agree that that there's we expect just a certain level of how to wanting to learn how to read a bill or wanting to learn how to read a regulation. We can it's a very collaborative effort of wanting to teach once you're on board, that kind of thing. So it's having some of those skills, but also just that curiosity that I was talking about. Amanda?
No, I completely agree. I mean, it's definitely helpful if you have some of the fundamentals and understand, how different aspects of the healthcare system but there's so much that can be taught, and especially at HIMSS, we have access to so many subject matter experts and SMEs and resources that can help get you kind of to the level you need to be. I've been here for 2 years and I really didn't touch cybersecurity before I became involved. And now it's definitely something I'm discussing on the Hill and that we've been focusing a lot, particularly within the VA in the past year. So there's always new opportunities to learn and grow. And I think once you can kind of bring that enthusiasm, you can go pretty far.
Awesome. Thank you so much. Yeah, my background is in public health, and then I'm currently doing the MBA program. And so I'm just really curious as to how, my background or my degree can kind of be flexible enough to go into a certain organization or industry. And so if you any sort of advice potentially in that for, him specifically, or if you think that, this is not the role that should, this is not something I should be looking for having this sort of background,
Yeah, I appreciate your question because I think it's, we have, I think latest count, we have 6 MPHs on staff, 3 of which work on the public policy side, and another 2 that are in the informatics team, and then somebody else on the and HIMSS analytics. But it's important to have, I think it's when you're looking at whether it's HIMSS or any other organization, emphasizing your experiences, whether they're internships or Amanda came to us having had been involved in a community outreach effort around dental health in an AmeriCorps effort. I don't know, she knows the specifics, I don't, but the point is, what attracted us to Amanda's resume and her skills is that she was able to talk about how some of her real world experiences interacted with technology or interacted with and how she project management, hey, this is my experience, this is what I did, this is what I might do differently, and this is what these are the other things that I would definitely replicate, and there is that word curiosity. Empowerment and curiosity are the 2 words that I think that these 2 team members are probably sick of hearing, but it's, I think it's an important thing for someone who's seeking a role, is that feel empowered, look for a job where you are empowered. Particularly in the nonprofit world, there's always more great ideas than there are people or there are resources. So if you're I like to talk to the team about, I've read How Google Works, and I encourage others to read it. And they talk about 70-20-10, and 70% of your day should be spent on your actual day job, and 20% should be stretching your day job in ways like Amanda's looking at, helping to look at health equity, but also looking at climate change and technology's role in healthcare. And then Evan is, very much, he's stretching into being a project manager on a cooperative agreement between HIMSS and the Office of the National Coordinator on interoperability issues. Neither of those things are necessarily core to their job, but they're stretching. The other 10% is something that you're absolutely curious about. So last year in 2021, the 10% for Amanda in my mind was that climate change in healthcare, and now it's becoming a little bit more of the core conversation. She's talking to other people within the organization. And Evan, my observation is, he was curious about genomics and some of the other capabilities around the All of Us campaign at NIH. But it's going in knowing that you're not only going to do your day job, but there's some things to stretch within your day job, and then something that you're absolutely, you just have this feeling that the organization should be paying attention to it, and you spend a little bit of time researching, particularly in the nonprofit world. Before too long, somebody's going to say, hey, we oughta, and you've already done it. Or you bring up, hey, I think we oughta, and they go, hey, let's go for it. And whether it's funded or not, they're going to do that. And Evan and Amanda, curious about your thoughts as well.
I think, the reason I got an MPH is because it was applicable in so many different ways. I did focus in policy because I kind of knew that was the direction I wanted to go in. But I mean, like Tom said, I was working at a nonprofit health center while I was getting it. And then I went into the private sector for a while before returning to the nonprofit space. So it's just kind of like, once you have your degree, you can use the background experience you got from school to tailor your interview and your skill set. And then you learn so much on the job of what you like and what you don't like. And then based from there, kind of build your career to fit the direction you want to go in. So I think having an MBA is obviously useful because you understand so many different business sides, and we have like a huge business side to HIMSS that I don't really work with. They do a lot of our global conference and events across the world. We have a whole marketing department that has their own projects, but then helps us a lot with the things that we're working on. So, I mean, there's always this, like, when you see a job posting, you just kind of have to look at, oh, do I meet like 70% of the things there? And what am I willing to show and grow? And how can I relate my experiences at school to what this organization's mission and vision is, and how can I help them get there? I think is, kind of what you want to focus on. And you can always tailor a position to what you want to do once you kind of get out there and start reading different descriptions. And LinkedIn is, I think, a great place to kind of view a broad variety of job opportunities at once and see where you fit best.
Yeah, I'll say quickly, because this was some great advice, but if you don't have the experience, say why it's important to you, especially when we're trying to talk to students. That resonates with me too. When I'm able to hear, they just talk about, they rattle off their resume, but a lot of times too, I like to hear about the person and why it's important to them, why this topic or this, area of expertise you're trying to get into is important to you. And that really is something that stands out to me. So you can't teach passion, and that's something that I've learned. And once you're passionate about something, you're able to speak to it really well. And that resonates when you talk to, whether it be employers or other faculty, students, whatever you're doing. So make sure you put that point across too, and that will go a long way.
So Daniela, what I want to emphasize everything that they mentioned. Certainly the 70%, I advise that, but I think also just taking self-inventory of your experiences and relying heavily on relevance and transference. So, how relevant is a particular experience that you have, regardless of the context where it took place, communicating that value and how that skill set or that experience is transferable to a particular situation or a particular role that you're looking at. So I like to emphasize the relevance and the transference. Yeah.
Awesome. Thank you so much. Yeah, I appreciate all of your wisdom, both in, the HIMSS kind of mission and vision, but then also in, your own personal endeavors. And so thank you for taking the time to answer my question. And I really look forward to looking back at HIMSS once, I progress more through my degree. So thank you.
Great. And Shania, do you have a question? I think we have 2 minutes. And if not, that's okay.
Yes, I will try to keep it brief because I don't want to hold you all any longer. I do thank you for your time. I apologize for my tardiness. I was coming from another meeting. But I did want to ask Amanda and Evan as well. You both mentioned being able to rely on other members of the team to grow and feeling supported. And I wondered what that looks like exactly, particularly in the onboarding process, but even afterwards.
Yeah, absolutely. So I think in my last job, something I learned that I wanted to focus on was company culture when interviewing at HIMSS. So I tailored a lot of, so I think the most important part of the interview is not necessarily your responses to the questions they ask you, but the questions you are able to ask at the end of the interview, because it goes both ways. Like you spend a lot of time at work, you better like your job. So I think at the end of my interview, I had just as many questions, and a lot of them were based on company culture. I did a pretty aggressive LinkedIn search of everyone who was going to be on the panel with me, which you can pull from the invite. And then I saw that Tom's been at HIMSS for 20 years. Evan's been at HIMSS for 5 years. Our coworker, Eli, 10 years. So I asked them, I'm like, why have you been here so long? Like, tell me why, because obviously you have every opportunity to change jobs that I do. Why are you still here? And a lot of it comes down to, flexibilities, different aspects, but you can kind of ask like what a day in the life looks like, how different teams work together, depending on the size of the organization. I came from one that was 11 to 15 people big, depending on the year. So it was really small, and I was kind of looking for a larger organization feel. And then definitely perusing the website, because you can learn so much about an organization, and there's like so many different aspects of HIMSS that I was like, oh, I see this on the website. Can you tell me more about it? I want to learn the different initiatives that like our informatics team, they work on so many different things and they're really the system experts. So they understand how things work on the back end of like the policies that I work to enact. So sometimes when I'm getting asked a question on Capitol Hill, somebody wants to implement a technology from a different aspect of healthcare to fix a problem in a different space. And they're like, can you tell me how this works? And like, frankly, no, I don't have that engineering degree, but I can go either find someone internally who does have that experience, or they can connect me to someone who's one of our members who has that experience in the day-to-day, and I can bring them there with me. So then we can have a really constructive, positive conversation.
Yeah, I know we're almost at time, but I'll just say quickly, HIMSS has a lot of different communities. And to me, community building is a really unique thing that HIMSS has. So we have folks that I rely to, whether it be my own career development, and also people that they know they can see the same faces month after month when we have calls, or we can rely on them like that. So that part of it is really important to me. And also we are a GR team, a government relations team, but there's so many different parts of HIMSS that we also talk to. And when I started, it was a little bit siloed, but that was something at HIMSS we wanted to break down as a culture, as we're not just our team, we're one HIMSS, and we're all working towards the same issues. So if I had a question, I didn't need to just rely on my team. I could kind of put it to the HIMSS universe, and I feel supported in that way. So if you see teams that are kind of just not looking at the broad picture, just tunnel vision, that's kind of a red flag in my mind. But HIMSS is something that really embraces the entire company, and that's been really important. And then the community aspect as well, that really makes my job fulfilling.
Thank you.
Great question. I don't have anything to add. These are just two dynamic people. Great question, great dynamic answers.
Well, Evan, Amanda, Tom, I want to thank you once again, and be respectful of your time. We've run over a little bit, which I hate to do. But thank you so much for being here today. As always, we value your collaboration, your insight, your wisdom, knowledge, everything that you have to share with us. It's great to collaborate as always. And so I look forward to keeping in touch, and I'm happy to share any information or opportunities available at HIMSS with our students. So definitely feel free to use me in that capacity.
Perfect.
Yeah.
Thanks so
So
much.
thanks everyone. Yeah.
Thanks a lot.
Thank
Brian,
you.
it's good to see you again.
Stay in touch.
Likewise.
See
Will be.
everybody. Thank you.
Thank you. Bye-bye.
Bye-bye.